Oh, this is a very good one. This is a 45-year-old male, chronic smoker, has some mild cough, has some minimal abnormalities on the PFT, nothing rip-roaring. LIP, DIP, good. DIP is a good thought. What is RIP? What is CPFE? Good thought. Combined pulmonary fibrosis and emphysema. RBILD, good. So the first thing, when there is a patient who has some mild rails and restricted PFT and the question of fibrosis, the first thing I do is I just go and look at the sagittal. Just a minute. You look at sagittal. Oh, it's still creating. Sorry, just give me a minute. Okay, we have proper sagittal. When we have the question of ILD, the first thing I look at sagittal is there any evidence of volume loss? In this patient, I do not see any evidence of volume loss. What I can see is the diaphragm is moved up and the lung is a little bit bulkier. I'm not seeing any evidence of volume loss. So I'm not gonna start with an ILD which has having significant volumes. But what I am seeing here is some faint peripheral reticulation right here. And also there is a lot of paraseptal emphysema. And when you come down here, there are some tiny loosened spaces within the subpleural lung, right? But that is also superimposed with reticulation. In order to call it as DIP, we need to have some kind of cyst, emphysema in the upper lobes and cyst in the lower lobes. In this patient, everything is limited to subpleural region and it is superimposed with reticulation. And there is some evidence, maybe the patient may be having some mild bronchiolitis. You can see there is bronchial wall thickening and all those things. But this patient is not severely symptomatic. What they are seeing is there is some mild reticulation, mild minimal paraseptal emphysema. When you see these kind of appearances, you have to have this is a new entity which is being propped up. It's called a smoking-related interstitial fibrosis. In DIP, you won't be having these reticulation and all. What you have is just, you can see cyst in the emphysema in the upper lobes and cyst in the lower lobes. When you have this reticulation superimposed with minimal paraseptal emphysema, you have to come up with this diagnosis called smoking-related interstitial fibrosis. There are people who are writing articles on that. On the axial section, you can clearly see there is some minimal subpleural cyst superimposed with some mild peripheral reticulation. It's not as rip-roaring as we see in UIP or NSIP. It will always be mild. In order to call it as CPFE, you need to have rip-roaring fibro somewhere else. Here it is very mild, so we can call it as smoking-related interstitial fibrosis.